Hi, this is Marlene Gibb with What Do You Do? And today's guest is Dr. Theresa Smith. And what do you do?
I am a chiropractor.
Okay, we're going to start at the beginning because you have an interesting life.
Thank you.
You didn't become a chiropractor till you were what, 40?
42.
42. And prior to that, you worked at City Hope?
For a small time, yes.
Okay, so talk about how you got to where you are, which is very, very interesting in the field of chiropractic.
I've been going to chiropractor since I was 20, so over 40 years now, because I have a very bad back. Not so much with being adjusted all the time. And when I was 30 years old, I was a single mom and had a great job. And I mentioned to my chiropractor that if I was younger, I would go back to school and become a chiropractor. And she said, well, so why don't you go back to school and become a chiropractor? I said, because I have a great job and I'm a single parent. And she kept bothering me. Like, why don't you go back to school and become a chiropractor? Because she knew I had done massage school.
Okay, this is what I want to. So you had a massage school. You worked at City of Hope. So you worked in kind of medicine.
Kind of.
Yeah.
I was administrative secretary.
Yeah, but you're still in the hospital
Yes.
environment.
Yeah.
That's
Yeah.
it's more medical than anything else.
Yes.
Okay, so then what made you go to massage school?
When I was young, I thought that was what I would like to do because I'm pretty good with my hands. But I didn't appreciate the attention it brought me, so I didn't continue it.
What do you mean attention?
Attention from men, basically, you know.
Oh, really?
Yeah, so I just wanted to massage. There was nothing else to be involved. So I didn't care for that. So when I had told my chiropractor, because she'd been my chiropractor for years, and she never knew that I wanted to be a chiropractor, so she just kept asking me. Every time I'd go in, she'd say, so have you figured it out? And you're not listening to me.
I'm single mother. I
have a job.
I'm happy.
Right.
Why should I change?
And then I do this thing every year on my birthday. I think about my life and where I'm going to go and where the last year's been and what it's going to bring me. And I just realized that life is short.
Mm-hmm.
And I might as well figure it out and go for it. And so I did.
So where'd you go to school?
I went to Cleveland Chiropractic College, which is a family name, and it was on Vermont and the 101 in LA.
I remember that.
Okay, and they have a campus in Kansas, and the LA campus is closed now.
Oh, it is?
Yeah. Yes, there's not enough students going through chiropractic school. Chiropractic is not as popular as it used to be.
Okay.
Yeah, sadly.
So so you still stayed in chiropractic?
Oh yes.
Okay.
I love chiropractic.
Okay.
That's how I walk, literally, because I would not be able to walk for weeks at a time. So chiropractic has saved me, and I know what it does for others.
Yeah, I've gone to chiropractors too. Yeah.
Yeah.
So why you've journeyed through a lot of chiropractic schools, extra credit, everything else.
Yes.
How many of them that you went to, because this is important, how many did you actually like and you felt were good?
One. And not necessarily the one I chose. I chose the one in LA because it was close.
The chiropractic school.
Right. The other
Okay.
one is up north, and it was just too far for being a single mom because I had to have my mother help me.
Right.
Yeah.
So you went to that, but then you came out and you have to get all your extra credits, right?
Oh yes, every year.
Okay, so you have to have those, CEOs or CEUs?
Continuing education, CE units.
Okay, right. So as a chiropractor, when you first started and where you are now within chiropractic, tell me the changes you've made.
I've changed my technique.
Yeah, so explain technique and chiropractic. Okay, tell me.
There are many different techniques that were created by different chiropractors. that are available out there. There's Diversified, there's Gonstead, there's so many, I couldn't list them all. So I started off being a sacro-occipital technique practitioner,
Is that-
SOT.
Now, is that pretty standard?
It is not standard, it is a specialty.
Okay,
Yeah.
that's you, I know it. Okay.
Yeah, of course, it's a specialty. But the reason I picked SOT was because I was having an incident in school and I couldn't walk, and you can only miss so much school. And the best of the best could not fix me. They couldn't roll me on my side and rip through the spasms. Nothing could fix me. And this one teacher, the SOT teacher, took pity on me, and she did her treatment, and I got off the table and I could walk.
Wow.
And so I went, this is for me, because it was so powerful, because I was dying in pain.
So what is the difference between that one and another one?
It's gentle, non-force,
Okay.
very gentle. So it's a wonderful technique. I still use a lot of the parameters today in my
Okay.
practice.
Okay, so then what else did you learn, and what else are you using?
Right now I'm focusing on the zone technique, and what that is that there are 6 centers in your brain that control your glandular system, your eliminative system, your nervous system, your digestive, your muscular or circulatory system. It covers everything. Because chiropractic is not about the low back pain or the neck pain, it's about the nerves that go from your spine to the organs and glands. It's the electricity for your organs and glands.
Say that again. I mean, I really want to understand this.
Okay.
Okay.
So the nerves that come from your
Yeah,
spine
Right.
go to all your organs and glands.
Okay.
It's the electricity for your lungs, your heart, your adrenal glands, your liver. They don't just sit there and run separately. They have nerves coming from the spine with the information from the brain back and forth
Right.
about what to do and what they need.
And traditional chiropractic,
Focuses on your low back pain and your neck pain,
and not anything in between, basically?
maybe the mid back pain. But most people, it's neck pain from car accidents, low back pain from accidents. So that's what they focus on, and that's what they market to.
Okay.
I am addressing system issues. So if you have an allergy, you come and I give you a specific zone adjustment, it will fix your allergies.
Okay.
If you have adrenal issues, I will give you a specific adjustment that will help your adrenals heal.
Okay.
Okay, because they're not getting enough information. So what I often say is, for example, let's say your thyroid. Your thyroid says to the brain, hey, I need some thyroid stimulating hormone down here. Can you help me out? And the brain goes, did you hear something? No, I didn't hear anything. Okay, we're good. And the thyroid starts screaming, help me, but the brain doesn't hear it because there's not enough electricity flowing through.
So everything in the zone is electrical,
Yes.
and everything in regular chiropractic is between the neck and the...
Pretty much.
Okay.
They're more focused on getting your spinal curves normalized and things of this nature.
Are there any other things that chiropractors do that are different? Let me ask you, how do people hear about you because of what you do versus what a regular chiropractor would do?
Right now it's mostly word of mouth,
Okay.
and testimonials on the internet always help, but it's mostly word of mouth.
Because I never, until I talked to you, excuse me, a couple of weeks ago, I never heard of this.
No, it's been hidden for a while, and another chiropractor came out a few years ago and started teaching it. And so I think there are maybe 30 of us around the world doing it now, around the whole world.
Wow.
Right, it's still new. And yet it's from a 1930s chiropractor.
Who's-
And he's of course gone. He would have lines waiting for him in San Antonio for people to get treated.
So who revised it then?
Who brought it back?
Yeah.
Dr. Pete Goldman. He's in San Francisco. And people fly from all over the world to see him.
And how'd you find him?
I found him on Facebook. There was an ad.
Really?
Yes. And I, of course, because I know what chiropractic is, that it's about the nerves that go to the organs and glands, I immediately called him up, and he wasn't ready. I said, you need to teach me right now.
It's
Because
like you, yes.
this is chiropractic, and I need to know the secret. So I was one of his first students. So he brought it back to life.
Okay.
And it is phenomenal, the things that it does.
Okay, but you're up against all the, for marketing purposes,
Oh.
you're trying to niche this, right? I mean, or not? Are you still staying?
I've never felt competitive in the chiropractic world. The people that need me find me, and I'm good with that. And word of mouth is lovely, because usually if I like the patient and they like me, then I'll like their friends, family.
Right.
So it's good.
Okay. So what other forms, they're out there? I mean, now this is what you really have your heart and soul in, into the zone.
Yes.
But just for informational purposes,
Yes.
what other ones are there?
Diversified, which is general, just a general whack and crack, you know.
Okay, okay.
Okay. There's NUCA, which I think is they just adjust the first cervical vertebrae, and they think that affects the whole spine. You know, and all of these things do work.
Right, right.
They work. You know, and if the patient believes they work and the doctor believes they work, they work. Right.
Well,
Because then
sometime-
that leads to that 85% of dis-ease is caused by thoughts. So that leaves 15% of trauma and toxicity. But most disease is caused by your thoughts. Because thoughts are things, they release hormones. When you get mad, hormones are released.
Right, right,
When you get anxiety, hormones. Those hormones have an effect on your entire body.
Oh, yeah.
Right. Well, people have argued with me about this.
Oh, no, they do. They do.
Yes. So if we can fix that, so that's why I say, if you believe your chiropractor is going to heal you, they will.
And if you believe they won't.
Then they won't.
Okay, so it's like almost any professional, if you, like with a doctor or a therapist or
Right.
whoever.
Right.
So now you've gone through 20 years of this. When did you find this, Dr. Goldman?
2 years ago.
Oh, wow.
2.5 years ago. Right. Yeah. Big switch. Right.
Yeah, I mean, you had to switch
Yeah.
everything around.
Yeah.
Did some of your patients object or?
No,
No.
because they're so blown away with the results that's so fast. I mean, it's minutes and there's a change. So they're so happy with that.
Do they sometimes have to have a readjustment when they come in
Oh, sure.
and be readjusted?
Yeah.
Okay.
Yeah. Sometimes it takes a few visits or several, you know, because you never know. People don't listen to their bodies very well. Their bodies literally have to break them down and make them scream before they go get help.
You mean knock, knock?
Yes, there's no, hi, could you help me? No, it's got to be, yeah.
I'm in pain.
Right, and most people wait till that. It's like, because I can muscle through it. Yeah,
Yeah,
you know, so
yeah.
you know.
Yeah.
Yeah.
That's very true. That's very true. So now, between your chiropractic, right, now you've gotten into horses, but I know it's not acupuncture, but it's acupressure. Do you do acupressure? Pressure? It's not chiropractic.
No, no.
So
Uh,
what is it?
I don't know how to adjust horses and don't want to go there.
That would be very hard to adjust horses.
I would imagine, but there's legalities involved, so I do not adjust horses and I'm not going to get involved. So what I do for horses, I do acupressure, or what I call myofascial massage. So my massage came in handy on the horses.
After all, and they're not making passes at you.
No, they don't make any passes at me. It's so much better. They make funny faces and noises, but yeah, it's so much better. So myofascial release on a horse, and a little bit of trigger point therapy, Reiki. They love Reiki.
Now explain Reiki.
Reiki is energy that flows from up above through you for healing purposes. And they love it. They respond in a minute, if that. It's fun to watch.
Could you feel them? Could you feel like they're probably tense? Don't they get tense?
Oh, they get very tense.
So then
Yes.
here you're doing this.
Yeah, you just put your hands right on. I just put my hands on them, and horses, when they're processing, they chew. So they start chewing and stretching their neck, and it's so fun to watch. And then I'm also doing the pulsed electromagnetic field therapy on them. PEMF, I call it PEMF.
Now what is that?
It is a machine that emits pulsed electromagnetic field, and Tesla created this machine.
Oh, really?
Yes.
Where did you find it? He's been gone.
I know, but yeah. So it's been in Europe for over 60 years. And I found it at a barn when I was working on a horse. Somebody was using it, and I asked what it was. And it oxygenates, it alkalizes, and it energizes cells. Well, on a horse, it's like a cellular massage, so it increases their performance. It can pull abscesses out of their hoofs. It makes their sore muscles lovely. It's like spa day for the horse. They love it. I, of course, love working on them. Yeah, they just love it. And it has a funny noise. It's a round coil. And you would think the horse would freak out, but I show the horse this coil as it's tick, tick, ticking. And as soon as I put it on them, they're like, oh, this is good. And they start the chewing and the licking, and they love it. And their owners love it. Because I've worked on this one horse, this poor horse. He just pees, just constant stream. I know, the poor, and it's really bad because it gets on the legs, and then he can't evacuate, so the bladder. So I do it to him about once a month now, but he now doesn't just, he's normally.
Really?
Right, so it's fantastic. Yeah, and I love that. I love seeing a horse get well.
What's that called?
PEMF, pulsed electromagnetic field therapy.
And people buy it where?
I have a machine, and you can buy things for the home use that are more affordable, but my machine is a $25,000 machine.
Yeah.
And so there's different places to buy it, and if somebody wanted to know, I'd be happy to guide them, because I know more about the companies now that are doing this, selling this product.
So this was a Tesla, but did you run under copyright or patent law or whatever?
I don't know if they've had to do any of that. I just purchased the machine, and I just love the results. So I use it on people with Parkinson's.
Really?
Yeah, you put it on their brain, and it helps their brain. It's great for anxiety, depression, broken bones. I use it on people with fibro, anything really. Yeah.
So people can come in and have this
Yes.
this machine.
Yeah.
Now this is the little one, or you're not using the Tesla machine?
No, I'm using the big machine. You just turn it down, so it's not
okay.
like for the horses.
Okay.
Yeah, 'cause the
But
horses-
you got 1,200 pounds, right, on a horse?
Yeah, 1,200 pounds or so, right?
Rather than
Yeah. So, no, there's a volume control.
we were talking.
Can you imagine?
Yeah.
And it doesn't shock, like it's not a TENS or anything, so it's not shocking you. Some people feel it, some people don't.
Okay.
Okay, so but the horses you can definitely see if they're sore, their muscles just bounce, and the horses don't care. Yeah, and they use it at the racetrack. Race horses have been using PEMF treatment for years.
Oh, I'm sure they had to.
Sure,
I
because
mean,
it increases performance.
Right.
The only drawback is that if anybody or a horse is on a drug, it increases the efficacy of the drug. So you want to be careful what you've taken prior, and you can't use it on anybody with implants of any sort.
In people or horses.
Right.
Horses don't have implants,
No,
do they?
but people,
do.
no pacemakers, no insulin pumps, right.
So you're very eclectic.
I am.
And you know, I mean, really, because you're doing the chiropractic, but
Yeah.
people can come in for other things. And how long does this PIMF treatment last?
It varies. It varies. You know, some people just come in and get their hands done because they have arthritis in their hands. So 10, 15 minutes, and then they can move their hands nicely.
And how often do they
you know, sometimes you have to start off a couple times a week, but then you could go down to once a week or every other. Depends on what you're eating.
So, okay, what diseases, I mean, what,
Any,
any?
because dis-ease cannot live in an oxygenated environment.
Okay.
Okay? So if you oxygenate your cells, the dis-ease has to go away. And your cells get energized so they can do what they need to do.
Is this, like, are you doing cold? Is it cold?
It's
No?
not cold or warm. It's,
Okay.
yeah.
So where do you see yourself going now? I mean, since you're going to, what's your dream? Because you've been doing so many things.
Yes, I see myself doing exactly what I'm doing for a few more years.
Yeah.
And then buying some land in Tehachapi and getting horses of my own and just working back and forth from there to here. Because I want to live on some land.
So you're going to stay up there a week and then come back into town?
You know, I might just come down once a week. We'll see. We'll see how it goes.
Are you going to keep your business here too?
I think so, for a while, yeah. We'll see. You know, it depends. I'm bringing my mother into the picture, so I'm going to have to take care of her pretty soon here, so which is great, you know. Make her last year's the happiest, you know. So we'll see how
Does
that
she
goes.
like horses?
She likes horses, yes.
You have to like horses to do that. Are there a lot of people doing what you do with horses?
No, there aren't. A lot of people don't even know what PEMF is yet.
Well, I didn't know till you were telling me. I mean, I
Right.
had no
It's,
idea.
well, there was a machine that came here, I forget how many years ago, but the FDA got rid of it, lickety-split. So they squashed it. So it's just now coming
the
over.
PEMF.
Yeah. Oh, yeah.
And why did they squash this?
Because it helps you get well, would be my guess.
Wow. Wow. So you would like, how many horses would you like?
I would probably just like a couple for myself, but I wouldn't mind taking care of others and having them on the ranch. I will, of course, be having a ranch hand because, you know, I don't want to have to do everything.
Well, yeah, I mean, look,
Yeah.
how many acres you talking about?
I'd like 20 at minimum. At least 20.
Because horses are very expensive to maintain, aren't they?
They are very expensive to maintain. They can, if they get colic, they can cost you a lot of money right now. Yeah. Thousands of
Really?
dollars. Oh,
Really?
yeah. Yeah. Mm-hmm.
Now, are you gonna do thoroughbreds or all kinds of horses?
I'm going to go the Mustang route.
Oh, do you see the movie Mustang?
I haven't seen it
You
yet.
got to see it. It's excellent. It's based on a true story.
Right. So I wouldn't mind being involved with that. That's another thing I want to go and learn. If I have to go, or maybe he'll come here, is a taming wild horses without any whips or ropes. I think that'd be just wonderful.
Well, that's a lot of the Mustang movie. He didn't. They were.
Oh, good. Yeah, it's just a great thing. So I know a guy, he's in Australia, in 5 days, from wild to mild. 5 days. I think that'd be just wonderful. And I know I'm older, but I'm going to ignore that and just go anyway.
So you'd bring them in from Australia.
No, no, no.
You're
We
gonna
have
go
so
to-
many Mustangs over
So
here. But if I can bring the teacher, I think that'd be fun.
Okay. So are other people looking for?
Yes.
I think the Mustangs, because there's a book, and I read it about 8 years ago. It's called Mustang, the Mustang,
Mhm.
and it's the whole history of the Mustang. I mean, it's a marvelous history of the horse.
Yes.
But you get into the cowboy myths and everything else. I mean, the cowboy myths. I was a little girl. My dad loved horses, so I'd always go to the movies with them. You know?
Yeah.
And you've got that whole cowboy myth, and then you find out it's kind of cruel, things like that.
Right.
And that book I highly recommend. I really highly recommend.
He's been saving the Brumbies, which are the Australian Mustangs.
Oh, really?
Yeah. There's quite a drought over there.
Well, are they?
So they're dying off, or so. Anyway, so he gets them and he teaches people how to tame them. It's great.
That's okay. Okay.
Mm-hmm.
Anything else? This has been very interesting to see how your life has evolved here.
Thank you. I'm just going to enjoy what I'm doing, help as many people as I can, horses, have a good time, you know?
Have you been to Australia?
No, not yet.
So are you going to? I know you're going to bring him over. Are you going to
I
go?
might go first. I'm not sure yet. We'll see how it plays out.
Yeah.
Yeah.
Yeah. So let's wrap up.
Okay.
So face your camera is there,
Okay.
and give all the vital information:
Oh, okay.
your name, your address, and your website or what.
Okay. I'm Dr. Theresa Smith. Thank you so much for watching. It was fun sharing with you. My website is Dr. Theresa Smith, and that's with an H. And my phone number is 626-358-3800. Thank you.
This is Marlene Gibb with What Do You Do? Thanks, Teresa.